Imagine your loved one, someone who has spent their entire life caring for other, now depending on someone else for care in their final years. It is heartbreaking to think that while they should be receiving compensation and attention, they might be suffering from neglect or abuse. Today, we are going to dive into the troubling issue of nursing home abuse, a reality that many families face but don't always see coming. This video is essential for anyone with elderly loved ones in care facility, and it will equip you with the knowledge to spot the sign, understand your right, and take action. First, let's define what nursing home abuse is. Nursing home abuse reflects to any form of harm or mistreatment that occurs within a care facility. This can be physical abuse, emotional or psychological abuse, sexual abuse, financial exploitation, and even neglect. Sadly, this type of abuse can affect your loved ones, leaving them in a vulnerable position where they cannot defend themselves. It is critical to recognize that abuse is not just about international harm but also about failing to provide the care that an elderly person deserves. So, how do you know if nursing home abuse is occurring? Often it is not, sometimes that is immediately visible, which makes it all the more frightening. In this section, we will go over the red flag to look out for. If you are noticing any of these signs, it is important to investigate further. Unexplained injuries, bruises, cuts, burn, or fractures that cannot be explained, or injuries that change in severity. Behavioral changes, fearfulness, withdrawals, or anxiety, especially when certain staff members are nearby. Poor hygienic or neglected health, bed sores, unclean clothing, or lack of medical attention to chronic health issues. Financial discrepancies, missing money, valuables, or unusually banking activity that does not match your loved one's habit. Well, it is hard to imagine anyone internationally hurting our loved one. There are unfortunately several factors that can contribute to nursing home abuse. Let's explore the root cause. First is understaffing. Many nursing homes are understaffed, which can lead to overwhelmed workers who are unable to provide the appropriate level of care. Second is lack of training. Inadequately training staff may not know how to handle medical condition or the need of elderly individual, leading to mistake or neglect. Poorly managed facility. Some nursing homes lack proper oversights, allowing abused behavior to go unnoticed. Financial pressure. Sometimes the drive for profits in for profits nursing home leads to concern being cut, resulting in lower quality of care. Residents vulnerability, the elderly, particularly those suffering from dementia or other contingency impairments, may be unable to advocate for themselves, making them easy targets for abuse. If you suspect your loved one is the victim of abuse, it is important to understand your legal rights and how to take action. Nursing homes are legally obligated to care for their residents and provide them with safe living conditions. If this duty is violated, there are steps you can take to ensure justice is served. What are your rights as a family member? You have the rights to advocate for your loved one's well being and to file a complaint with the state regulatory agency that oversees nursing home. Filing a lawsuit. If abuse is proven, you may have the right to file a personal injury lawsuit against the nursing home or the responsible individual. This can help compensate your loved one for pain and suffering and hold the facility accountable. A state and federal protection. Nursing home must comply with federal law under the Nursing Home Reform Act, which required facility to provide quality care. A state law also offers protection and regulatory agency can investigate allegation of abuse. Well, it is impossible to guarantee that abuse would not happen. There are a step you can make to minimize the risk. Let's talk about how to choose a safe nursing home and way to monitor your loved one's care. Choosing the right nursing home. When selecting a nursing home, visit multiple facilities, read review and inspect the condition. Look for clean, safe environment and a staff member who appear attentive and caring. Don't hesitate to ask about the staff to residents ratio. Regular visits and communication. Regularly visit your loved one and make sure to check on their physical and emotional well-being. Open communication with staff is crucial. Ask questions and observe their interaction with residents. Know about know what to ask. Ask about the training of the staff, how incidents of abuse are handled, and what steps they take to ensure residents' safety. This shows the facility that you are vigilant and involved. A staff involved. Consider installing a video monitoring system if allowed. Being an active and informed family member can significantly reduce the likelihood of abuse. If you believe your loved one is the victim of abuse, immediate action is crucial. Speak up. Talk to the management of the nursing home and report any concern. Document everything carefully. Contact authority. Call Adult Protective Service or local law enforcement. Nursing home abuse is a crime, and authority will take your claim seriously. Consult a lawyer. Consult an attorney who is specializing in nursing home abuse. They can help you navigate the legal process and advise you on the best course of action. Thank you for joining me in today's is important discussion on nursing home abuse. No one should ever have to endorse mistreatment in a place supposed to be a safe haven. Now that you have the tools to spot the sign of abuse, protect your loved ones, and take legal action, you can make informed decisions that prioritize their well-being. Remember, you have a voice, and that voice can make a difference. If you have any question or experience you did like to share, please leave them in the comment. And as always, don't forget to like, subscribe, and share this video to spread awareness about nursing home abuse.